Well, hello and welcome. Good evening and welcome everyone to this live telephone town hall meeting we have for you with San Bernardino County residents. Again, good evening and welcome. We are so glad you are here. You are live on the line for our telephone town hall meeting with our San Bernardino County residents. This is a live virtual forum, and it is your opportunity to discover the array of resources available in the community to support behavioral health and well-being. So again, good evening and welcome. Thank you so much for joining. You are live on the line with us for our live telephone town hall meeting with our San Bernardino County residents. Again, this live virtual forum is your opportunity to discuss the array of resources that are available in our community to support behavioral health and well-being. The Office of Suicide Prevention is an expansion of the Department of Behavioral Health Prevention and Early Intervention efforts. This administrative office will focus on education about suicide prevention with a message of hope and resources. Pain isn't always obvious, but most people show some signs when they are thinking about suicide. Warning signs may appear in conversations, through a person's actions, or in social media posts. If you observe one or more warning signs, especially if the behavior is new, has increased, or seems related to a painful event, loss, or change, please reach out. The county and department are here and available for anyone who is struggling to overcome suicidal crisis or mental health-related distress. The County Crisis Response Team, CCRT, is a community-based mobile crisis response team for children and adults experiencing a psychiatric emergency. CCRT is available in English and Spanish 24 hours a day, 7 days a week, 365 days a year by calling 888-398-0018, or you can text 909-420-0560. If you are experiencing an active life-threatening emergency, please dial 911. Tonight, during our telephone town hall meeting, we're going to start by hearing from 2nd District Supervisor Jesse Armendarez, and we're going to also hear from Department of Behavioral Health Director Dr. Georgina Yoshioka. Then we're going to jump right into questions and answers from those of you live in our listening audience. So as you're listening in tonight, think about questions that you might like to submit for that Q&A part of our forum. And when you do have a question, just press 0 to get in line with your question and provide it to an operator. You can either ask your question live tonight over the air, or just let your operator know if you prefer me to read your question, whatever is more comfortable for you. So again, that's pressing 0 to submit your question tonight. Also, you may have questions about how the Office of Suicide Prevention will help our community, what resources are available for those in need, and how to recognize and respond to signs of suicide risk, or you may need help yourself. Again, press 0 to submit a question for Q&A. You can also press 7 tonight to give us your email address to get updates from the Office of Suicide Prevention. If you or someone you know is experiencing a mental health crisis, or if you'd like to talk with someone, you can press 8 on the keypad on your phone to be transferred to our County Crisis Contact Center at any time during this live forum. Tonight, during our telephone town hall meeting, we're also going to run some survey questions and give you an opportunity to provide us with feedback and request assistance just by voting on the keypads on your phone. All right, to officially get us started tonight, it is my pleasure to turn it over to our County Supervisor, Jesse Armendarez. Supervisor Armendarez was elected to the San Bernardino County Board of Supervisors in November of 2022, and he took office on January 2nd, 2023. He was born and raised right here in San Bernardino County and is a strong believer in hard work. As the 2nd District Supervisor, he oversees the communities of Fontana, Mount Baldy, Rancho Cucamonga, San Antonio Heights, and North Upland. Supervisor Armendarez, please jump right in and get us started off tonight.
Good evening, community members. I want to thank you for tuning into this town hall to discuss the new Office of Suicide Prevention. This topic is near and dear to my heart. For me personally, and as your county supervisor, I am passionate about mental health, wellness, and our community. It is an honor to bring the behavioral health resources directly to you during this program. You will have the opportunity to ask questions and learn what San Bernardino County is doing in the realm of suicide prevention. I am joined by Department of Behavioral Health Director, Dr. Georgina Yoshioka.
Thank you, County Supervisor Jesse Armendarez, for hosting this event tonight and highlighting the Office of Suicide Prevention. As mentioned, I'm Dr. Georgina Yoshioka, and I'm the Director of the Department of Behavioral Health. With this new office, we'll be able to focus on education about suicide prevention with a message of hope and resources. Promote hope. Let's talk. Before we discuss this office and for our audience questions, I want to acknowledge the topic of suicide may be hard for some to discuss. You or your loved ones may have been affected by suicide. During this program, if you'd like to talk with someone, you can press 8 to be transferred to our County Crisis Contact Center, or they can be reached directly at 1-800-398-0018. The calls to the contact center are received 24 hours a day, 7 days a week, and 365 days. Now I'll pass it back over to our moderator to open the Q&A.
Excellent. Great. Thank you so much. We're going to jump right into our questions now, and I also have a polling question to get us started off with. So very special thank you again to Supervisor Armendarez and Dr. Georgina Yoshioka to be here tonight with us. So on the keypad on your phone, we're looking here for some feedback from you tonight as well. So I want to remind everyone to submit your own question tonight. Just press 0 on the keypad on your phone. And while you have your keypad out, we want to hear from you. Do you feel equipped to talk to your loved ones about suicide? Press 1 on the keypad on your phone for yes, I feel comfortable and equipped. Press 2 for no, I would be interested in a training. So again, just respond by giving us the feedback by pressing the buttons on the keypad on your phone. Do you feel equipped to talk with your loved ones about suicide? Press 1 for yes, I feel comfortable and equipped. Press 2 for no, I would be interested in a training. And right now I want to start us off with a question that we get a lot. This is a great one to start us off with. Dr. Yoshioka, what is the Office of Suicide Prevention and how will it improve our community?
Yeah, that's a great question. Thank you. So the Office of Suicide Prevention it's an educational office, and it's going to provide the opportunity for the community to access resources and education about suicide prevention. And we'll host community trainings, and they'll be available for presentations upon request also. And we want to ensure San Bernardino County residents are equipped with the resources to prevent suicide. Supervisor Armendarez, would you be able to expand more on the Office of Suicide Prevention as well as your passion around it?
Yeah, so for me, it really was about getting resources back to our community and how we can do that and actually let people know that we are here and we're here to listen and teach those who are dealing with these crises some techniques, some things to watch out for. I think it goes back to, at the end of the day, this became a passion of mine because I have a family member who deals with mental illness, and seeing the struggles that we went through, it just exposed me to the holes that are in the system. And for me, when I got elected, I felt it was a great opportunity for me to move forward and help those people who may have went through the same thing I did, not having the knowledge, not having the accessibility to know where to go or how to navigate. So for me, it's one of those things that became a passion through, hard situations. So, at the end of the day, this really is about just bringing more resources to our community.
Yes, absolutely. Thank you so much, and I'm so glad that you're here with that passion. So I want to read that polling question again and want everybody to feel like they can respond if they didn't already. If you already voted, you don't need to do so, but we still have members from the community joining us right now. So a reminder to everyone, the polling question was, do you feel equipped to talk to your loved ones about suicide? Press 1 for yes, I feel comfortable and equipped. Press 2 for no, I'd be interested in training. So I'll repeat that one more time, and then we'll reveal some results here. Do you feel equipped to talk to your loved ones about suicide? Press 1 for yes, you do. You feel comfortable and equipped. Or 2, for no, you'd be interested in training. And I want to let everyone know that based on these responses, you'll be contacted to be connected with resources, and we can offer you free training that you'll be contacted by the Department of Behavioral Health. And department staff will reach out within 2 to 3 business days, so keep an eye out for that. So, all right, let's reveal these results here. Thank you, everyone, so much for providing your live feedback here. This really helps us to get a grasp of who we're speaking with in our conversation tonight in our community. Supervisor Armendarez, Dr. Yoshioka, it looks like we have 63% of our listening audience tonight says yes, they're comfortable, they feel equipped to talk to their loved ones about suicide, but that leaves 37% who would be interested in a training. Your thoughts?
Well, this is really good poll results for us to know and recognize the importance of the Office of Suicide Prevention. Just with that, is that seeing that with the majority saying that they do feel comfortable yet, but also understanding that there's some that are saying that a training would be great. Through the Office of Suicide Prevention, one of the elements that we talked about was the opportunity for training. And through this office, DBH will be hosting a Safe Talk training in April and May. And over the course of taking this training, participants will learn about being able to notice and respond to situations where suicidal thoughts might present, recognize that invitations for help are often overlooked, move beyond the common tendency to miss, dismiss, and then also avoid suicide. They'll be able to apply the talk steps, tell, ask, listen, and keep safe. And they'll also be able to know about community resources. And so, Supervisor Armendarez, again, as you shared about your passion in the establishment of the Office of Suicide Prevention, you mentioned from a personal standpoint that you didn't know about these resources. So with that and hearing about these resources, how do you think, can you share your thoughts about how this will benefit the individuals that in the poll said that they would benefit from this training?
So I look at this in 2 different ways. The first one is we have, 63% who say they feel equipped. I think that 63% personally, if they feel equipped or feel the courage to be able to have those conversations, we can give them more tools. Mm-hmm. We can give them better direction on signs to look for, different numbers like, the numbers to call, things of that nature. And for those who don't have a clue, like myself was at one time, it gives us hope that we have somewhere to turn to. It allows us to say, yeah, we don't know, and help us so that we can be equipped, so we can have that training, so that when that opportunity arises where we have to speak to somebody, or we know how, and when we know what we can do and what we should do, versus, shooting from the hip and, not having the outcome we may want necessarily. So I think these numbers are great, and look forward to more dialogue on this.
Absolutely. Both great points there, Supervisor, and thank you, Dr. Yoshioka, as well. All right, we're going to go to a question next from Marcella in our live audience. She's in San Bernardino. If you want to ask a question just like Marcella did, just press 0 on the keypad on your phone. Marcella, you're live right now. Please go ahead with your question.
Just wanted to say my condolences, Supervisor, for your loss or the situation that you went through. But as a community member, I wanted to know, for the immigrant population that constantly have questions and don't know what to do, what will be the resources to give them or to guide them to? And is there any particular funding that will be attached to those that are considered indigent?
That is a great question, and what I could tell you that I know before we switch over to, I'm going to go ahead and call her Dr. G, if you don't mind. Dr. G.
Absolutely.
At the end of the day, because that's what we call her in the office, we do have benefits currently, or translations in Spanish currently, and if there's other languages that we need to expand to, I'm sure we can get those resources available. Right? Am I correct, Dr. G?
Absolutely. So through the Office of Suicide Prevention, we primarily will always ensure that we are able to provide both training and presentations through other language options, and one of that would be through Spanish. And also we're also going through the Office of our early intervention programming. We also can connect individuals to these services as well. So definitely, if there is a ask for this type of support, we will make sure that it happens for anyone that's seeking this type of support, training and presentation service.
Did you get the answer you needed there?
Yes, and then in addition to the translation, I don't know if it's preliminary, but will there be a cost associated for those that are indigent?
Not at all.
No.
Thank you so much.
No problem.
You're welcome. Thank you for the question.
Yes,
I think that's
Marcella,
a great question.
Yeah.
Yes, so glad that you were able to join our conversation tonight, Marcella. Love it. Thank you so much for coming live. I'm also seeing questions coming in, and people are asking us to read their questions, and that is 100% fine. We understand that this can be a very sensitive topic, and we are just so glad to have all of you listening in, learning from our live conversation. And yes, please press 0 if you want to submit a question, and you'll speak with an operator. Just let them know you'd rather me read your question over the air. We are 100% fine with that. Before we get to another question, though, I have a polling question for you now again. So we had great feedback on the last one and love that this is just another way you can communicate with us here. So this polling question is a little bit of a different one. We get to ask you what you think here. So we want to know, according to you, does talking about suicide encourage it? Press 1 for yes. You think that it does, and that's why you don't want to talk about it with your loved ones. Press 2 for no. It does not. It provides the opportunity to talk about those feelings. So again, I'll read through that polling question, and you can vote by pressing the buttons on the keypad on your phone. Let's talk about this. Does talking about suicide encourage it? So again, using the keypad on your phone to respond, press 1 for yes. Talking about suicide does encourage it, and that's why I don't want to talk about it with my loved ones. Press 2 for no. You don't think it does. You think it provides the opportunity to talk about those feelings. All right. While everyone continues to weigh in on that, we're going to go to our next question here. This comes in from Janie in Rancho Cucamonga, who did ask that I read his question. It says, what should I do if I'm struggling or someone I know is having thoughts of suicide? Great question, Jamie. Thank you so much for bringing it to us tonight. I'll pass this over to you, Dr. G.
So most importantly is to know what the resources are. So today, as we're talking about the Office of Suicide Prevention, about the training and the presentations, but we also want to talk about these very important resources. One is starting with 988. This is a crisis and suicide lifeline that can be called. This is very similar to 911, but 988 is a line in which you'll speak to someone who will be able to provide you with resources for yourself or for a person who you may be with at the time that you're wanting to help to get the services because they are talking about the topic of suicide. Also, the Department of Behavioral Health, as mentioned earlier, is about the Crisis Contact Center. Again, knowing that this is available 24/7 and also does assist persons with other languages, Spanish, any other one, we're able to assist them with that. So Supervisor Armendarez, with those resources, did you want to add any additional resources that you would like to highlight for this question?
Not necessarily highlight, but I think it's important for them to know that these are resources that are available, and especially if someone is dealing with it or has thoughts of dealing with it, that this is your immediate place to go. But that at the end of the day, that's what the whole purpose of this town hall is. It's about let's talk, let's have that conversation and ask those great questions. We've had 2 great questions thus far that I feel that really hit home with what we're trying to accomplish here, which is get those resources out, and also if you're dealing with something, 988. It's all there. What I'd like to see more is stuff, and we've had this conversation before. How do we get it to the schools? How do we make sure that the students who are dealing with issues have those same resources, and maybe it's just a PSA that goes out to show them that there is someone here, and we are here to listen, and we're here to help.
Absolutely, and I think also bringing these trainings and presentations to the schools is very important, working with our school districts and being able to work with the school personnel. Every person who works in a school touches among the children, and that's why it's so important that we're able to bring this information to them. So it's a great point.
Absolutely. Yes, and just another way, I know we're just saying we are here, we want to help, but during this call, Jamie, I'm so glad that you reached out to us. This goes for Jamie or anyone else. You can be transferred directly off of this call to our County Crisis Contact Center at any time just by pressing 8. If you or somebody you know is experiencing a mental health crisis and you'd like to talk to someone right now, just press 8 on the keypad on your phone and you'll be directly transferred to our County Crisis Contact Center. All right, I want to take Elizabeth next, but I just want to give everyone one more chance to respond to that polling question. If you didn't vote already, we're going to reveal the results after we take Elizabeth's question. So let us know, do you think talking about suicide encourages it? Again, press 1 for yes. You think it does encourage it, and that's why you don't talk about it with your loved ones, and press 2 for no, it doesn't encourage it. And with that, let's take Elizabeth live. A reminder, you can press 0, just like Elizabeth did, to bring us your own question. Elizabeth, Rancho Cucamonga, you're live right now. Please go ahead with your question.
Hi, everyone. So my question was basically, I took training back in college, and so I do feel equipped to talk to my loved ones and my friends and whatnot, and even other peers that I don't even know of. However, I wanted to know, because I would love to further my training, and on top of that, if I'm going to further my training, I want to spread the word, and it's specifically in like the school districts like you guys talked about. I think that's very important to put it out there, especially for adolescents, teenagers. Although it's a sensitive topic, I just want to know, what are my further steps besides doing extra training to go into those schools and be active and be an advocate?
I'll chime in just a little bit. I would say, just being that advocate in itself is one of the probably most important things you can do, and connecting us with the people who want those services. If you have schools in mind that you've talked to already, or you have organizations in mind that you've talked to already that want to host the training at their facility, like that's what the whole conversation is about, right? Like, at the end of the day, how do we get those resources out to the public? You being that advocate and wanting to fill that hole in that need in our system, I commend you for that, and I personally look forward to working with you and figuring out how we can work together and help you accomplish that goal.
Yeah, and for the Department of Behavioral Health, we have opportunities such as joining our volunteer program. So that's something where you can go on our website, locate that resource, and when we give you a call back, you can also ask for this information, but this gives an opportunity for a person such as yourself who's wanting to be out there and spread the importance of this information, especially to our youth population, as well as for parents, and then for all persons in our county. And then the other also is that we for the Department of Behavioral Health, we have a peer family advocate position in our county that you can actually apply for, and that actually will put you into different types of programs that you'll be able to take this level of advocacy as you shared with us today. So thank you for asking this question. It's a really great question.
Yes, absolutely. Elizabeth, thank you so much for joining our conversation tonight. So glad to have you in our community. All right, let's reveal these results up next, and I'm excited because Sarah from Upland had a question that says, does asking someone about suicide put the idea in their head? So we polled our audience, and Dr. G and Supervisor, we had 6% of our listening audience today who said yes, talking about suicide encourages it. 94% says no, it does not. So I'm going to turn this over to you, Dr. G, to weigh in here and fill us all in.
Yes, that's a great question. So the answer is no. Studies have shown that actually persons by asking people about their suicidal thoughts and behaviors does not cause or increase such thoughts. And asking someone directly, are you thinking of killing yourself, can be the best way to identify someone at risk for suicide. And so with that, Supervisor Armendarez.
I guess, the homework was done before we start this, and that the whole premise of this is let's talk. So, you're right. The studies do show that when people talk, they act. It's when they're not talking, we have to worry, right? Like, at the end of the day, when they subdue themselves, go into a room, so to speak, and don't connect with the world, or feel they have no outlet. That's when the mind gets to work on itself and could lead someone to the wrong thing. So knowing that people are here to listen, I think is huge, and I think it doesn't hurt. I think it's what we want to do.
Yeah, I think that's a great point, Supervisor Armendarez. I think it goes also along the line of to promote hope, that they know that someone is there, as you mentioned, to listen, someone that is going to hear what they're saying, and along with that is being able to share with them the resources that they're aware of, and this is opportunity today that we're able to share those resources with all of you.
Yes, absolutely. Love it. We are here talking about it. So glad to be here. Let's go right away to Shannon's question next. A reminder, you can press 0 to submit your own question, either to go live or just let us know you'd rather us read it, just like Shannon did. Again, that is absolutely fine. Shannon in Rancho Cucamonga says, Dr. Georgina, Dr. G, is the staff there trained to deal with developmental and intellectual disabilities? And again, that comes from Shannon in Rancho Cucamonga.
Yeah, that's a really great question, and we always want to make sure that with our staff that we provide them an array of trainings to allow for them to get the experience and knowledge of working with all individuals, especially with individuals with disabilities, as mentioned. So I think it's really for us is also us collaborating with our Inland Regional Center as well, and being able to do this type of training and presentations to the Office of Suicide Prevention, and more importantly, knowing that our staff do have the training and necessary ability to be able to ask the appropriate questions as well as make the right referrals to the places to help an individual.
I'm so glad to hear that. I think it's one of those things that I never even thought crossed my mind recently, and so to hear someone else ask for that, I think it's very important that we make sure we have those resources, and thank you for letting us know that those resources are available.
Yes, absolutely. And Shannon, thanks so much for coming on and asking about those. Appreciate you. Let's go right away to Ashley next in Rancho. And after Ashley, I want to give you a few websites that you can write down. So if anybody wants to grab a pen and paper, I'll be able to share a few websites with you. But right now, let's take Ashley in Rancho right now. Ashley, you're live. Please go ahead.
Hi. I was wondering if having one or more absent parents increases the likelihood of a child committing suicide. I was just wondering because a lot of parents work these days, so they're not always home to raise their kids.
Dr. Georgina?
Yes, that's a great question. Thank you, Ashley, for bringing that question forward. I think that if we were going to look at what the risks are for suicide, some of what we could look at is things that are related to the fact that all gender, ages, ethnicities can be at risk for suicide. And again, as you mentioned, based on a household, this is another factor that can be considered. However, the main factors that I want to share today is to talk about the considerations of areas of such as a history of suicide attempts that presents for the individual or even in the family, depression or other mental disorders or substance use disorder, could be related to chronic pain, family history of mental disorder or substance use, family history of suicide, also exposure to family violence, including physical or sexual abuse, presence of guns or other firearms in the home, having recently been released from prison or jail, and exposure either directly or indirectly to others, suicidal behavior such as that of family members, peers, or celebrities. So again, I would say for Supervisor Armendarez, and hearing just me listing all those potential risk factors, how do you see that the importance is the question I was asked about, the importance of how in a household it's so important to parents to have this knowledge?
I think it's key to have the knowledge and to know what to look for. From what I've seen, personally, from people that I've known, at the end of the day, it doesn't discriminate. You have families who you would think were the model family, and you have single moms raising their children. You have people who you thought were, everything was moving in the right direction, and a life is lost. The mental health and the stability of an individual, I think, is the most important thing, and that's what we need to focus on. And all these different situations someone can be in are risk, I believe, but at the end of the day, it's a person's individual history, and do they have a past? Does the family have a past? Those should be more important than whether they grew up in a single household or with a complete coercive family.
And then most people who have, again, to share more on this topic, is most people who have risk factors for suicide will not attempt suicide, actually, and it is difficult to tell who will act on suicidal thoughts. And although the risk factors of suicide are important to keep in mind, someone who's showing warning signs of suicide may be at higher risk for danger and then need immediate attention.
I do have a question for you, Dr. G. Is there any numbers out there or studies that show, like, a person will attempt or cry out how many times before they actually go through with it, or is there a statistic on that?
That's a really great question. I think the most important, what we find is that, again, understanding that sometimes the signs can be there and then they may not be there. I think the most important goes back to the importance of talking about suicide in your home, talking to your family members, to your children about what that means, and again, talking about what those signs and what those feelings are, and being able to come forward and say, I need to talk to someone. And again, understanding when a person comes forward and says that you're very open-minded. It's not anything to say, no, this is not, you cannot do this, but to listen, to hear what's going on for them.
Great.
Great. Thank you both so much. And thanks so much for bringing that comment up, that question up, Ashley. All right, up next, I told you to grab a pen and paper, and I hope you did, because I have a lot. I'm going to give you websites and resource phone numbers, because, man, I just want everybody to have this everywhere that they possibly need it. So our number 988. I shouldn't say number 1. I should say number 988. That is our crisis and suicide lifeline. As Supervisor Armendarez said earlier, just keep that in mind always, 988. I also want to give you the Department of Behavioral Health, the Crisis Contact Center. This is the one I read at the beginning. Their phone number is 800-398-0018. I also like this. You can text them at 909-420-0560. Both of those are available 24 hours a day, 7 days a week, 365 days a year. They are always available. As always, if you're experiencing an active life-threatening emergency, please call 911. I also want to give you the Department of Behavioral Health Office of Suicide Prevention website. It is, get ready to write this down, wp.sbcounty.gov/DBH/OSP. If you'd like to email us a personal question, absolutely fine. You can email dbh-oSP@dbh.sbcounty.gov. You can find us on Instagram at SBCDBH, and I'm going to give our operators that information too. So if anybody needs that and wants that repeated slowly, just press 0, speak with one of our operators, and they can provide that for you there as well. So make sure we're taking notes, sharing that, but always just remember 988. And during this call, remember you can press 8 at any time if you or someone you know is experiencing a mental health crisis and would like to talk to someone. You can press 8 and you're transferred directly to our county crisis contact center without dialing. All right, let's take our next question. Now, this is a great question. I have a few teens that are on social media all the time, and I'm really looking forward to this answer. I'm really glad that it was brought up tonight. From Sammy, it says, what if I see suicidal messages on social media?
That's a really great question. I know, the most important is knowing how to get someone help when you see that there's a post on social media, and doing so as quickly as possible can help save a life. and many social media sites have a process on how to get help for the person posting the message. If you see messages or you see live streaming content that shows that someone is actively engaging in suicidal behavior, you can contact the safety teams at the social media company. However, they will reach out, and then they'll reach out to the person with the help they need. However, you also can access some of the other resources that we shared earlier, such as even calling 911 if you feel that that's an immediate need with that. So, Supervisor Armendarez, I mean, just hearing that, I know you have children at home, and therefore knowing that and they're active on social media, what do you think about what should be done and how that can help for families?
I mean, from my understanding, I think we can actually notify the social media content person themselves and let them know that there is someone who could, almost like a complaint or a violation, to see if they can get that person the right resources. But also, if you see something, it's like that old saying, see something, say something. If you see it going that way, it might be something where you can DM them and say, hey, are you okay? Sometimes, we've had conversations where, sometimes it's just the act of saying, are you okay? That can change someone's decision. So, saying, hey, man, there's a 988, number you can call if you need help, just basically spreading the word of the resources that are available. And it goes back to the whole purpose why we had this today, is really getting as many people as possible to know what the resources are and what they should do. And that's just my 2 bits right there.
No, I think that's great. I think also reaching out to your parent, like if you have a parent in the home, to immediately go get them, maybe even teacher, someone. And again, these resources, what we're talking about is being able to bring these trainings to both parents and teachers about what the resources are so they can act immediately.
Yeah, and when we think about it, with the social media platforms, when it comes to our young children, these are people they know. These aren't people they don't know a lot of the time. So I feel like there's that opportunity for them to say, hey, are you okay? And giving them that information, I think, is the most important part.
Yeah, that's a really great point.
Absolutely. Thank you both so much for answering that, and thanks for bringing that up. Sammy, I have a great question now that we're getting in from a few different people. That is, I hear everyone talking about the teens, and I just did it myself. So I'm so glad this just came in. But what about senior citizens, and can we talk more about how mental health impacts them just as much? We have someone coming in. Judy says she's very passionate about getting mental health care available and affordable for seniors.
I'm sorry.
So for me, I'll start off with this. Our seniors are some of our most vulnerable population today. Whether it becomes insecurity on housing, insecurity with food, how do we get those resources to them? We are active, at least I could say Second District. What we're trying to do is, how do we create value? How do we show people we care? How do we show them that, that they deserve the accolades that they deserve because, they've been here. They're our history and they're our mentors. So for us, we do stuff like we show up to senior facilities and we give cakes for people's birthdays. We send them letters congratulating them on their birthday. Having those interactions, I think, are some of the first steps. But also, it goes back to, I'm going to probably continue to say this throughout the night. It goes back to let's talk and getting those resources out there and letting people know that those resources are out there and who they can call, because loneliness is a big factor when it does come to these type of depression, whether it's depression or suicidal thoughts, right? Like loneliness is a key factor, especially for our senior citizens. So those are my tidbits on this.
No,
Dr. G, tell us the real.
That's great. I think just to add that, in the county we have our Department of Aging and Adult Services that we partner with very closely in being able to ensure that we can provide behavioral health services to our senior citizens. And additionally, resources, exactly what you said, Supervisor Armendarez, the importance of addressing the fact that there's a component of loneliness, which is one of the risk factors that we shared about that lines to the risk of suicide. So they have what we call the Age-Wise program, so definitely a program in which you can reach out, connect with their services, and have someone come out to the home and be able to provide both the family as well as the senior citizen with services and community engagement, as well as being able to offer some presentations and trainings to them as well.
Excellent. Thank you so much. And I see Allie also in Highlands who came in just now with a very similar question. So I see that being such a prevalent question in our community. And I think that's just so neat that we're looking out for everyone, and so glad that everyone brought that question forward tonight. Thanks everyone for joining our conversation. Let's go right away next to Emily here, who asked that I read her question, another really good one. I'm so glad that you brought this forward, Emily. What are some of the common signs, or let's say warning signs, that someone may be thinking about or contemplating suicide?
Yeah, that's another great question, because I think, again, when we talk about the risk factors, but now we're talking about what are those common warning signs. And some of those would be an individual that's talking about wanting to die. They talk about the actual word of suicide. They can present with uncontrolled anger. There could be increased use of alcohol and drug use, reckless behavior, feelings of hopelessness, desperate, or even feeling like they're trapped. They're sharing that they have no sense of purpose, talking about being a burden to others. And I think lastly, the most important also is putting affairs in order. So with that, Supervisor Armendarez, with your thoughts on that as regards to the warning signs.
Yeah, it's funny because I feel like we often mistake the warning signs from someone being in a bad mood, or we don't take them seriously.
Mm-hmm.
This right here, this is concrete. After studies, people are saying these are the signs. Look for these things. The one I never thought was putting affairs in order. If you would ask me, I would have never said that, but it makes total sense, right? At the end of the day, if someone starts putting their affairs in order, they plan on doing something. They're taking that next step. Being able to you, Dr. G, to be able to educate me on this gives me some additional tools that I can use to look for those warning signs, whether it's at home or, out in the public. Thank you.
No, I think, and another is a fact that someone may be giving away very personal items to them, items that are very close to them and dear to them, and maybe giving them away to persons and actually saying, like, I want to give this to you. So as you said, as you shared, Supervisor Armendarez, it's so important that, being able to listen, but again, being able to talk and say, why are you giving this away?
Yeah, even for my personal family, which I don't shy away from. I have no problem saying that, my family has issues and here's how we're working through them. With my family member who suffered from bouts of depression and things of that nature, until it was an issue, we didn't realize it was an issue. And I think that's one of those things that we have to be conscious of, and having these key things to look out for allows us to give us that compass we can use to say, hey, do we need to step in and let's talk? Actually, having, are you okay? Those simple questions.
That's great.
Yes, absolutely. And I think this is a great point, too, for me to also just repeat those resources that are available to everyone. 988, that Crisis and Suicide Lifeline. Just remember it as that lifeline. You can transfer off of this call to our Crisis Contact Center, but I'll give you that phone number as well. It is 800-398-0018. That's the Department of Behavioral Health Crisis Contact Center. Both of those are available 24/7, 365, no matter the day, the weather, Christmas Eve, Mother's Day, they are available to talk. Let's talk. Absolutely. I want to give you our website again, wp.sbcounty.gov/DBH for Department of Behavioral Health /OSP. That email again, I had some folks press 0 again to speak with our operators to get these repeated. Make sure they wrote them down right. That's perfect. Fabulous. Great thing to do. Press 0 if you want to make sure you're writing these down right. Our email address is dbh-osp@dbh.sbcounty.gov. You can follow us on Instagram as well, SBCDBH. And right now I have a polling question again for everybody. So grab your keypads again. This one is for all of our parents on the call. We want to know, are you aware of suicide prevention services at your child's school? And I should say for any guardians here at your child's school. Press 1 for yes, I'm aware. Press 2 for no, I didn't know, and I would like more information. And remember, based on these responses here, you'll be contacted to be connected to the resources and or those free trainings that we discussed that are offered by the Department of Behavioral Health. And we'll reach out within the next 2 to 3 business days. So go ahead, I'll read that again for anyone who wants to weigh in here. For any of our guardians on the call, are you aware of suicide prevention services at your child's school? Press 1 for yes, I am aware. 2 for no, I didn't know that was available, and I'd like more information. All right, let's take our next live caller. While everyone weighs in there, keep providing that feedback. I just love this instant feedback. We have such an engaged group tonight. But Allie, right now in Highland, you are live. Please go ahead with your question.
Thank you. Good evening, Supervisor Armendarez and Dr. Yoshioka. Thank you both for this informative call and for this forum, and also for establishing the Office of Suicide Prevention, which is so important. My question is, how can individuals who are themselves at risk or have a belief that one of their loved ones in their household may be at risk of suicide help to make their house safer against the risk of suicide?
Yeah, I can chime in just a little bit. So for us, what we did, and I don't know if Dr. you can tell me if these were the right things, but what we did is we didn't leave the knives on the counter. We didn't have any guns in the house. Anything that could be a harm to a family member, we removed it. I don't know if that was being grandiose in any way, but we felt, with what we knew at the time, that we wanted to not give any option, but if I could do it again, I would have engaged more. Mm-hmm. Instead, let's talk and ask how they were doing and try to get them to the help they needed versus just hiding away stuff. We have to promote hope at the end of the day, and we can shelter our house, but that doesn't stop the mindset, right? Mm-hmm. So, that's what we did. Yeah. Do you have suggestions?
No, I think that's great. I think you really highlighted the really importance about, the safety of the person and really being able to look at the home to see. But as you mentioned, you can't basically see or foresee what could be used in that of the person who's thinking about that. But I think, as you mentioned, is being able to secure the house, but also getting the person to the place where they need to get the help, and really being able to access resources in the community, such as our crisis walk-in centers, our crisis stabilization units, places where you can go where a person is able to stay up to 23 hours and be able to be properly evaluated. And I think most importantly is asking while you're there about what is the best approach, because also understanding is that when you're coming back home, the person being able to say, like, in my home, I do have guns, and the one question they'll ask is, are they locked? Are they securely locked? Do you know, does your loved one know where the key is? And you'd be like, absolutely not. So I think those are the main steps to take, but I think you highlighted a great point of what, we think is the right, but then ultimately, like you said, being able to be here today and hearing about there is extra steps that can be taken.
You brought up a very good point. The CRTs that are out there, we were fortunate enough to be able to use one of those, and, it took a lot of encouragement on our side to get them to want the help. Mm-hmm. So, it's not going to be an easy task, but, understanding and knowing what to say and having them work with someone who can get them to say, hey, we understand you're struggling. Let's get you the help you need, and here's how we can do it. Because we are not capable, at least my family, we weren't capable of giving them the therapy they needed. So we had to rely on others, and, the CRTs came in clutch for us
Yeah, the crisis residential treatment facilities are great because they're able to offer a safe place for individuals who need additional time to be able to stabilize after they've been able to be addressed the immediate psychiatric crisis that they may have. And with that, in the city of Fontana, there is a crisis residential treatment facility as well as a crisis stabilization unit, and they're a person at the CRT, as you mentioned, Supervisor Armendarez, is that they can stay up to 90 days. And that's great. Family can visit. They promote the opportunity for family visits, groups, individual therapy, and again, also assisting the individual if they're taking any type of medication to continue to be stabilized and eventually be able to return home with their loved ones.
And they also help stabilize them too. Mm-hmm. Through our episode that we went through, having them there. The most important thing you have to realize when you're going to utilize CRT from a personal level is they have to want to go. Mm-hmm. So there's no point in taking your loved one who doesn't recognize they have a problem. You have to talk to them enough so they realize they have a problem and that they need that help, because they could literally walk in and walk right out. And you dropping them off doesn't change that factor. And I could tell you we learned the hard way. As a family, we learned the hard way, and it became conversations. It became conversation starters to encourage them that this was the right thing, and this is where we need to get you today, and show them hope. Yeah.
And talking about it, right? Yeah. And being able, even after, if the person, for your loved one who went and maybe decided that they did not want to stay, but even for yourself to know what that resource is and being able to have that continual conversation and talk about the benefit for them to be able to go back, but know that they're not alone, that you're going to walk through the door with them, and know that when they come out that you're going to be there. And I think that's what's really important as well. Yeah.
Absolutely. Such an important question, Allie. Thank you so much for joining our conversation tonight, bringing it so that we could open that up and discuss it here live with everyone. Thank you so much, Dr. G and Supervisor as well. I want to go right next to another question here. I know, my goodness, time flies. We're getting a little short on time here at the end, so I want to combine a couple of questions I see here. We just have such an engaged crowd tonight that I want to provide them with, well, let me just get to the questions. Okay, here we go. Are there what opportunities are available for our listeners and myself, everyone in the community, to learn more about how to recognize and respond to the signs of suicide risk? And thanks to the 3 or 4 of us that I combined in that question there. So, Dr. G, I'll pass that to you.
Yeah, that's a really great question. Want to be able to share with everyone on the call that there is opportunity for parents to access resources in the schools, and that is through individuals that are providers that are on site, and they basically provide what we call Success First, their early wraparound services, as well as the school age treatment services and student assistance program. Now, every school district and every school within them have access to these different services, but definitely if anyone is wanting this information, to please feel free to reach out to us, to the department, so that we're able to provide this information to them.
Absolutely, and yes, I didn't say this too, but we had 68% of our listening audience who was not even aware, and I can honestly say, before I got involved in this program, I wasn't aware of those services as well either. So just so important, and I'm so glad that you guys are on here educating me and everyone along with us. We're going to add a few polling questions in here as well up next as we're getting a little bit closer towards the end of the call. We've just had fantastic feedback. So first one up here, with our community that is already so engaged, we just want to know, how can we continue to help you going forward? How can the Office of Suicide Prevention best engage your community where you are? So on your keypad, there are 4 options. I'll read through them twice here so that everybody can listen. So don't vote yet. They are: number 1, suicide prevention trainings; number 2, community presentations; number 3, awareness and media campaigns; And number 4 will be social media. So let me go ahead and open this up for everyone so you can go ahead and vote. How can we help you going forward? How can the Office of Suicide Prevention best engage your community? Press 1 if it's suicide prevention trainings. Press 2 if it's community presentations. Press 3 if it's awareness and media campaigns, and press 4 if it's social media. So I will read those again. So everybody go ahead and weigh in now if you haven't already done so. How can the Office of Suicide Prevention best engage your community? Press 1 for suicide prevention trainings. Press 2 if it's community presentations. Press 3 if it's awareness and media campaigns, and press 4 if it's social media. And I know we're going to run another poll in just a moment. So while everyone is weighing in on that, Dr. G, do you have any more stats, or maybe do you want to talk more about that Safe Talk or Assist training that are coming up in April and May?
Yeah, again, I want to share that these trainings and presentations are free. They're open to anyone, whether it be a resident in the county, to a program, to a school. Please reach out. We are more than happy to set up these trainings. We are very excited in working with Supervisor Armendarez at this office and be able to provide this opportunity. So this is really us being here today allows for us to be able to really highlight what the resources are and know that this is going to help everyone that's here today. And, again, knowing that you're going to be spreading the word about this event as well. So we definitely are here to help where we can.
I think it goes back to let's talk. Like, we promoted, we're promoting hope by saying let's talk. All these things are available to us. These are tools in our toolbox. And, we need the public's direction on how we can be, better to serve them. So I think this polling question here is very important for me personally. So I'm hoping as many of you who can answer will answer this one, because this is going to help us in the direction we're going to move forward to in the future of how we can help our constituents in our community.
Yeah, I think there's a lot of outreach opportunities. I know, Supervisor Armendarez, you do a lot of outreach events really into your district, and I think it's so important throughout the county to be able to highlight the information that we're sharing today and continuing to promote the Office of Suicide Prevention. So continue to get the message, as you mentioned, is to really just continue to talk about it and really promoting the aspect of hope to everyone to say, hey, we're here. This is not just going to end today, but this is just the beginning.
Yes, absolutely. Thank you so much there. And I have one more polling question for you, so I'll give everyone 10 more seconds here before we stop and move to our next polling question where we need your feedback on. So last chance to say, how can the Office of Suicide Prevention best engage your community? You heard the supervisor ask. Please do vote. Let us know. Press 1 for suicide prevention trainings, 2 for community presentations, 3 for awareness and media campaigns, and 4 for social media. So go ahead and weigh in there before I close it and move on to our next and final polling question. Man, we've just had such great feedback here. Thanks everyone for weighing in on there. And this final polling question is, we would just love your feedback on this forum. As we said at the beginning, it's the first one that we've done like this, reaching out to the community over the phone about this topic. So we want to know, did you find this program useful, and would you like more of these forums? Press 1 for yes, it was helpful and you'd like to look for more in the future. Press 2 if it was not helpful, and then press 3 if you have a different idea and you'd like us to reach out to you about that. So again, wow, these results are coming in, and man, they're just making me so grateful for everyone on the call tonight. Did you find this program useful, and would you like more of these forums? Press 1 for yes, it's helpful, it's been useful, and I would like to see more of these forums. Press 2 for no, you did not find this helpful. And then 3, I have a different idea. And with that, my goodness, I don't know where the time has gone, but with that, I will let everyone know that if you still do have a question, comment, or concern, my goodness, we took as many as we possibly could. But if you still do have one, we still want to talk At the very end of this conversation here, you'll be able to leave us a voicemail message. If you have an urgent concern, please do not leave us an urgent issue there. Dial 988 so we can talk there. And with that, I will turn this over first to Supervisor Armendarez for a few closing remarks as we draw here to the finish line.
Yes, amazing conversations. I want to thank everyone here today just for joining us this evening. You know, as stated earlier, this is our first time hosting an event of this kind, and I was really hoping that everyone found it engaging and informative. You know, this is just one more way of me making sure that I am accessible and accountable for everything we do here at the county as your 2nd District Supervisor. The conversation does not have to end here, though. If you take away anything from today, we have a lot to discuss. Have those discussions with your friends, your family members, your coworkers. Thank you for tuning in, and I am your 2nd District County Supervisor, Jesse Armendarez, and I want to take a moment to actually thank Dr. G for joining me here today, and I'm going to go ahead and pass it over to you for your closing comments.
Thank you again, County Supervisor Armendarez, for creating this safe space to have an open conversation about suicide. As a community, we can come together to support our friends and our loved ones. We'll know the resources that are available to you and equip yourself with the tools to have these conversations. Together, we can promote hope. Let's talk. So additionally, wanted to just as a reminder to share our Crisis Contact Center phone number. It's 1-800-398-0018, and just want to be able to provide that number so if anyone feels after this call that they need to reach out and talk to someone, that we do have staff that is available 24/7, 365.
Thank you all so much for spending this last hour with us and for just this great, eye-opening, great discussion, great conversation. We appreciate each and every one of you. Together, we can promote hope. Let's talk. Thanks, everyone. Good night.